Welcome back to our two-part episode with Milton Chen, the CEO and co-founder of VC. Dr. Chen is a graduate of Stanford University, where he completed his PhD. He's a computer scientist, but also a philanthropist and healthcare equity advocate. How has healthcare inequity played a part in perhaps your life before your career and now as an advocate in your career?
Yeah, I definitely know like there's people, these visionary, they have their plans, they have their things. I wish I could tell you that, but to be most honestly, I was just really clueless in there. I would say before VC, I love reading books. One of the thing I really enjoy is going to like the Stanford Library, check out book. Of course, they use it in the Stanford through the life of 80 years. There were like 3 people check out that book. Right? I love just like digging through, just like brother. I love that in there. Right? So again, I would say that was like my pre-VC in there. Like I said, I read a lot, but in terms of like these sort of like the actual field experience, understanding people, I would say I was beyond naive in there, like literally just completely clueless in there. So then now fast forward to now, like I think there's now I feel like I feel like just being sort of grateful, able to, like do something that's maybe valuable to other people in this. And so now I feel like this is something that definitely motivate me a lot in this. But like I said, you look at not just me, our leadership team, right? They all have worked in refugee camps, right? So we actually just, I think nothing beats just going there, like really working, and that I think the inspiration, the understanding, and seeing the impact is extremely rewarding in this. I could definitely say like I'm a completely different person than the bookworm I was like, in universities and graduate school.
So sometimes there are moments like that come along in your life and they completely change your trajectory. But it sounds like you're also on a team with people who are similarly motivated and have strong experiences in around the world.
Yeah, definitely there. I would say, in fact, within my team, I'm not the initial proponents of doing this, NGO work. He was actually my very first VP engineer. So before he joined VC, he was volunteering in Darfur. Like he would literally just like get on the airplane. They go like every single year, sometimes 3 times a year, like going there, like take care of the children in there. Again, it was like when he joined VC, again, great. Like first thing he did was like, great, okay, like he had this Darfur project, let's adding healthcare to them. It was an obvious thing. Again, so I would say I definitely benefit from like people around me whose heart is a lot more kinder and gentler, who's really that like huge movement. Again, that definitely influenced me to essentially pull me into some of the orbits and do these projects.
So that was one person, but now it sounds like you have a circle of people that you're kind of attracting people who are similarly involved in this work, and you're all motivating each other.
Yeah, definitely. I would say they actually have volunteered. They literally have work in refugee camp, all these things. We're now part of our company's like persona or company vibe in that, right? It's like, we're not like a company that's like 100% just maximizing the profit, right? I believe in profit, but I do believe in capitalist society. I do all these at the same time. Is I think you could do both in this. So, and then even beyond this, so we're very fortunate, right? So, for example, working with your organization, like all the stuff we have done in the Philippines together, I'm very grateful for you and your team, all your physicians. And then there's other, additional group of just people now, almost over the last 15, 16 years. I got the privilege of meeting all these wonderful people. So now we have a whole network just people. Like we have now project in like so many different countries, and definitely really grateful for all those people.
Well, certainly that network is some of what we hope to accomplish with this podcast. I think we'll have people from all over the world listening to each other's stories and hopefully connecting after those podcasts to other people that they've seen doing work in this area that they can collaborate with. Our audience might be wondering, so how does Healthcare Alliance and VC know each other? How did you come to be involved with the Healthcare Alliance for an Equitable World?
How we really got to know each other, I think we did a bunch of emails. I remember we had dinner in San Francisco, and that was phenomenally good dinner. I know we had like a bunch of really interesting conversations, and I think I share with you some of my thinking. Of course, you share with me your vision for HAEW, and then just like I believe that dinner was a catalyst moment. We got to know each other again, not in the superficial, in a very profound way. And then, of course, fast forward of all the free clinics we've been doing in the Philippines, and again, all the clinicians and you personally, plus your physician buddies and your partner alliance working together. I think I'm super excited to partner with you.
We are too. And I am also a little bit of a nerd, and we certainly enjoy brainstorming and mindstorming with each other about how to make things work and make the world a better place. What do you see as the value that having a group like Healthcare Alliance, albeit, you've talked a lot about how important the in the person on the ground work is, right, in any healthcare innovation. And yet we have this group of people that works virtually and they're not in person. So I think that is a model, what we would call a hybrid model. So how does that benefit your in-person work?
Great question. I love this question. By the way, so I think to do a successful project in this, so I'm 100%, you have to have boots on the ground, but it doesn't mean 100% of your team need to be boots on the ground. It doesn't mean, right? So it's really, I believe it's like everybody, they're like synergetic, right? They're different. It's almost your take, let's say a bunch of people put them together. When they complement each other, that value they create, they could do something much bigger in this, right? So I think one of the things on my personal level, which I really enjoy, like working with you and your team is, right? So I'm a technology nerd, right? So like at the end of the day, right, I don't know I don't know medicine. I'm not a physician. Right? Able to have a deep partnership with your alliance, able to work with physician, have a physician just say like, do the change that it's not working in the right. So I think it's creating that feedback from technology and the clinical side, able to go back and forth to them. I think that's actually a winning formula in this. In fact, I would say for the audience members, if you think of doing something similar, right, you can't just have a bunch of really smart programmers in this. Of course, you can't just have a bunch of really smart physicians in there. Your team should have both. In fact, they should complement each other. I think that's a winning formula.
That's really insightful, and you're right, because this is the time we're living in our growth as a society, where technology is growing rapidly. Artificial intelligence will be part of medicine, and to have those things grow without a synergistic connection with the clinical community will not be of benefit as it would if it were developed together. So awesome and amazing insight. Thank you. What's next for you and for your VC team in promoting health equity? You talked about the first 1,000 days project in the Philippines.
So we basically have two big threads or efforts in this. First is the Philippines. Your audience might even say, why did we decide to enter the Philippines? So as I was going to all these countries doing projects, of course, my personal insight was it was very difficult to scale from pilot to full scale deployment. We decided let's just pick one country and go so deep so we could do a full scale nationwide deployment. So in the Philippines, our biggest project there is this baby 1,000 days program. Our second project there is creating an emergency response system across the whole country. So again, in a lot of communities, right, they don't have like a 911 you should dial. It's very fragmented in this. So we're tying together. And the way we're doing things in the Philippines is we want to do this at scale to essentially create a blueprint so that any other countries can copy what we do. Again, so we do a lot of writing on this, going down to the actual ultrasound probe. Like, for example, there's a lot of options. Which one is low cost, work well in the field, all these are. So again, our vision is to we do this thing ourselves with our partners and create this a detailed blueprint that anyone is welcome to copy into their own community in there. So again, that's a big project in this. Our second project is actually something in the US. So, like every time when I fly back, to San Francisco, right, you just see, well, there's a lot of people in the US who also needs help, right? Whether I know, I live in San Jose, California here, the homeless population, unfortunately, just exploding. And it looked like the curve doesn't look good. It's not like curves coming down. The curve seems to be continue increasing. If you look at America, about 50% of the counties, if you look at the maternal child statistics, right, their statistic is comparable to a low-income country, right? It's not just because you're in the US, you're that much better. So in the US, then we are in the process of launching our AMY project. I know this is the audio, so people can see. So a project is called AMY, AIMEE. Again, this is some of the project we've been spending many, many years in the planning phase. And we're pretty excited. We're actually going to launch this. We're going to do a soft launch next month, and then we're going to start gearing up for more use by the Christmas and New Year's. And the purpose of the AMY project is a cash-based healthcare, but the target price point is you could see a provider by telemedicine for $10, literally the absolute lowest cost. And then we're working with a partner company that provide the lowest cost on medication. You take your lowest cost on GoodRx you find, CVS, Walgreens, Walmart, whatever, our price, huge reduction over that. There. We also have a lab partner working with us to create really low cost laboratory in this. We're putting all this together under AMY. Again, the goal is to say, look, healthcare shouldn't be something where you go to, for example, CVS, whatever things, right? Like now, by the time adding the clinician fee, lab, medication, you're really not walking out of there less for $200, right? Which is unfortunately very expensive for, probably 50% of Americans in this. So how we came with the price point, is it possible to able to see a provider for the cost of a movie ticket? Can you get medication that's ridiculously low cost? Can you get really affordable laboratory in this? So that's why we're really excited about this project. We're hoping as we launch this, we would love to, of course, partner with your organization. And our goal is to say, let's just do something good for the low-income countries or create that blueprint that anyone can copy and paste. And then in the US, let's create a big effort who are just for that roughly 100 million Americans who are struggling with healthcare, cause all these, give them an avenue to say, look, you could actually see a doctor, you could see a nurse practitioner for literally $10.
So you have access to a mixed audience of people here. What would you say you need, or what would you ask from people listening to this that may be in healthcare or people not in healthcare that you would need to help make progress on these equity efforts?
Yeah, I was for for example, our project in the Philippines. I think number one thing we'd like to get some donations to buy medical equipment. So, for example, our current project, we're working with the government. We want to set a goal for every expectant mom get at least one ultrasound. And I mean, of course, a lot of the women, it's hard for them to come into the city, right? The travel time, the expense is very prohibitive. So in our models, could you actually just take a simple telemedicine kit, go into the community, right? You bring the care to them. So again, we want to able to buy enough of these medical equipment, specific ultrasound, to able to do 100% coverage. That's right. We will also love to have relationship with pharmaceutical company where they can make donations or at least able to bring the cost of these sort of medication to be significantly lower and so on, again, in the Philippines and in there. So I can think those are just really resources in there. And then in the US, in this, our number one wish is to get more companies to become our sponsors, because part of our model is we would love for them to say, offer Amy to as almost a benefit to their customers, to their employees, as well become underwriter sponsors to our program so that we can just bring care to more Americans.
That's awesome. You could perhaps offer Amy to migrant farm workers all across the states. That could be an amazing benefit.
Oh, definitely. In fact, part of our concept for Amy is like we're just 100% political neutral in this. We just view healthcare is one of those things. We're just like, if you're in America, you should be able to have access to low cost, high quality healthcare. So we think it's just all sort of slice of society that got to benefit from the Amy service.
Awesome. Okay. So how can sponsors, pharmaceutical donors, medical equipment donors, anyone that wants to work with you or help you get in contact with you?
Yeah, the good news is very easy. And so just my email, just Milton, MILTON at vcvse.com in there. Again, I would love to basically hear from all of you guys.
That is awesome. I can't tell you, it's always a pleasure to chat with you. We didn't brainstorm, we just kind of chatted a little bit, but it's always a pleasure. I'm very grateful to have you here today. I will say to our audience, thanks for joining us on this episode. If you found our conversation insightful and thought-provoking, please share it with a friend who shares your passion for this topic. Your feedback is invaluable, so please take a moment to leave a review. We're genuinely interested in hearing your thoughts and ideas, which help us with our mission to continuously improve the podcast. If you're inspired to be a guest on our show and share your own insights, don't hesitate to reach out by emailing us at info@haew.org. And for those looking to delve deeper into our mission, support us, or find out more about our work, visit our website at https://haew.org. Thank you for being a crucial part of our global healthcare equity journey. Thank you for joining us, Milton.